No?
Yeah, we're good, Ray.
Okay. All right. Hi, everyone. Great to be with you guys. Thank you for sharing your Saturday morning. I'm Ray Chung, Executive Director of SmartAirLA. First off, I want to thank DataCon and LA Tech for Good for hosting this event and inviting me. And yeah, for today, I just want to kind of go over what we're doing and love to keep it an open discussion and love to hear your questions and answers. And I'll bring a discussion, hopefully. Okay. So just a quick background about SmartAirLA. We're a nonprofit organization. Our mission is to empower communities suffering from air pollution to improve their health and environment using data. We're fortunate that we've been recognized as the most innovative project by the Los Angeles County Department of Health Services and Community Clinical Association of Los Angeles County. We're also very fortunate to have the support of Blue Shield California Foundation, the Knight Foundation, and work very closely with our colleagues at LA County Department of Public Health and our partners at the Asthma Coalition of Los Angeles County. As you mentioned, my background is I'm not a data scientist by training. I've worked a lot, especially in climate change in China and technology. But I'm also a native Los Angelino, second generation, grew up here, and life has brought me back full circle to come back here to work on pollution issues. So before I begin talking about the data, I want to talk about the why, what we're doing. And for those of us who are familiar with Los Angeles, group of Los Angeles, Los Angeles remains actually the most polluted county in the United States. The air has gotten better, but it's still a very polluted place. It's the worst in the country, actually, and it has some of the highest rates of asthma. And the communities that suffer the most are the communities of color. And asthma and air pollution ends up being the leading cause of school absenteeism and missed work. So when we look at asthma and the pollution that causes asthma, it's really devastating. It's not just a disease. It also results in people not missing school and families not being able to go into work, whether they care for their children or they just are sick. So the social economic impact is devastating. Just among children, and we're talking about underserved, poor children, there's over 70,000 children in Los Angeles County with asthma. African-American children have the highest rates. Almost 1 in 4 African-American children have asthma. And if you're children of poverty, 1 in 10 have asthma. The areas, there's many asthma hotspots in Los Angeles, but one area in particular is the Port of Los Angeles area and area of Wilmington. It's a really unfortunate, polluted and asthmatic area. So it's a pretty major problem here and continues to be. And now we're facing COVID. COVID is actually really devastating these communities. Harvard School of Public Health has done a study that has identified asthma pollution is actually a direct correlation with high fatality rates of COVID. So the people are dying the most from COVID are polluted asthma communities. And the research has shown, and it's evolving, that air pollution weakens the immune system, the lung functions that make the disease more virulent and fatal. This on the right is a very interesting map about Long Beach. What we see in Long Beach, again, it's part of that area near the Port of Los Angeles, the most polluted area in the country. 70% of COVID deaths are from people of color, and they live in the high pollution areas. So if you look at that map just on the bottom of the right, and you see the zip codes where the cases per 100,000 population by zip code in Long Beach of COVID, the dark areas on the left are exactly the same areas that the highest rates of pollution in Long Beach and the highest rates of asthma. So if you're polluted, you live in a polluted area and you have asthma, unfortunately, it's going to be highly correlated to higher case of COVID. So this is the situation we're kind of working on, and hopefully our efforts are focused on alleviating. Before I jump into what we're getting on the data side is our principles and code of conduct. It's very important for us when we work with data, particularly in these communities, that we have rules and we're focused on, as our mission is driven, empowering these communities. And as important, we have to protect them on that. So there's basically two parts of this that we really adhere to. It is a learning process. We make mistakes, but we are guided by these principles, and we want to keep on, listening and learning, and be good stewards. First on the left is our principles. Everything we do is geared up to be empowered by the community, for and with and by. And what does that mean? It means that we work with the community and our community organizations in terms of data, that everything we do has to be understandable and actionable. Like, we steer away from jargon. We don't get into all the minutiae of technology, because that is actually ineffective. We want to make sure everything we do, people can understand. It's that rule of you're talking to your grandmother, that you know exactly what we're up to. Second is we want to keep it simple. This is a process, we have to learn, like everything we do in terms of our data analytics, our relationship, we have to keep it simple, that it's focused on the goal at hand. Again, not adding more complicated issues. And it's hard because, we get into it and we sometimes forget what we're doing, why we're doing it. And third is, as this is probably the most important, is we need to listen and respect the community. Everything we do, we have to, listen what their feedback is, and also respect what their views are. This is a learning process, particularly when we're working in technology and data. It's not like we have the data and we just hand it over to the community and we're proselytizing or evangelizing these communities. That we have to be able to understand what they're coming from and what their concerns and their issues are. And again, this is not easy. This is very, very challenging. And through this process, we are able to hopefully develop the trust and the cooperation to really dive down on these issues. The area we're specifically looking at is, on practical terms, is then the code of conduct. What does this all mean? Data collection, data is very, very sensitive. We're talking and working in communities that have been exploited, historically exploited, and continue to be exploited, as we see from COVID and air pollution, all those important issues. So we have to go in there and think about protecting privacy and developing the mechanisms to do that. So what we do when we go through this process of data collection is we only use anonymous and aggregated data. We make sure that any data we use cannot be used to be personally identifiable, that can link to specific individuals. This is very, very important in the age we live in, because we don't want to be a source of exploitation. Data, as we know, is very powerful. It can be exploited. We're particularly working in immigrant communities that are by the current federal government administration is under attack. That people are using, agencies are using data to actually round up immigrants. And that's something we have to be very, very cognizant, that what we do does not lead, or at a minimum does not cause any problems on that. Second, we minimize data collection. Data collection itself, as a data, obviously more data is better, but we also recognize the act of collecting data is very disruptive, and that the data itself that's just sitting there can be exploited by unscrupulous players. For example, we want to avoid a situation that we could be subpoenaed by the Immigration Custom Enforcement Agency to hand over any data. Well, so we are designed that everything we do is, again, protecting the community in this effort. Third is transparency. We have to be very clear where, as much as we can, without violating privacy agreements and such, that what we do with the data, how we're using it, is helpful. So these are like our code of conduct and our principles of operating and entering in our effort. So I'm going to jump right into what we're doing. So with that, if I can, there you go. We have developed, with these goals and principles in mind, we've developed an asthma alert system. We're very fortunate. We work with a very strong coalition of community organizations, community health organizations, and healthcare organizations that work in this community. This is extremely important for us because these organizations are members of the community, they're the voice of the community, and they have the trust of the community. So instead of us parachuting in and trying to do something that, on our own, that we have to respect the people, the organizations, the leaders on the ground that are already in there and know the community and have the trust. So we work with them. As important, the community organizations is that they work at the communities at their circumstance. Underserved communities are underserved. They have lack of resources. They've been exploited. There've been lots of all these issues that are coming up. So we have to recognize it's not what we want that to get them to do, is what they want, and we got to follow. Again, this is not an easy process. It's a lot of listening. We've made mistakes, but we have to go in there with humility. So with that, we've developed, and we're in the process of piloting and testing an asthma alert. Very simple, using data. We are just predicting when someone's likely going to suffer an asthma attack. And with that information, we send out a text, a very simple text alert to the community organizations and to the patients in the community and say, basically, today is a bad day for asthma, take care of yourself. And that's it. And hopefully give advice and actions that they can do this. So by doing this, our goal is, how do we use that data that we have and the data analytics we have to share that with the people so they can actually do something to protect themselves? So a simple asthma alert text. From a clinical side, from a healthcare side, hopefully the patients are able to then use that to improve their management of asthma. They can, healthcare organizations can use that to provide care that can preempt emergency room visits, and then later to advocate for pollution mitigation. And the second part of this effort is we've developed an asthma heat map. Again, the goal is using actionable, making sure there's actionable data. I think our previous speakers in the keynote noted is data is only good if it's being used. We can, and that's something we have to keep in mind. We can do the most elaborate models and do all this. If it's not being used or no one cares, then we failed. So one of the things we are focused on is now, how do we get the data analyzed and make it actionable and as a tool to stop pollution asthma? So going back to that message of respecting and listening to the community, we are, first of all, going through a process where we listen to the community, let's say in this area, the LA Harbor, Long Beach, which is our focus pilot area, is to just identify additional pollution hotspots. Listen to the community and say, where is it bad? Rather than just looking at the data, which we do, we also want to kind of capture that knowledge of the community, because the community members know what areas are particularly bad, which are polluted, and respecting that and using that knowledge. And then we go through that process of getting information from the community and then visualizing that with data. So from here, you see a map of we're working with our partner in Long Beach to identify pollution hotspots, the different sources in the area, and then developing a map on the right. The right represents basically asthma danger zones that we've identified with the community that show like the colored areas or high areas of high asthma exposure risks. And the second step we go through is then where we can add value, perhaps, is doing the data analytics behind it. Again, we are focused on making data actionable and easily understandable. So what we did right here on the left, as you can see, is we mapped out with the community feedback and doing some paired up with analytical studies like where the pollution hotspots are, the asthma danger zones are, and then we try to find an indicator data that can measure the impacts. And what we did here, we just mapped out the schools in the area and then just looked at their absenteeism rate. Again, very, very simple, saying these are the areas that are bad. Let's look at the impact. So if you can see on the left, it's very, very interesting. You see clusters of schools that have really, really high asthma rates, and those are correlated to actually their pollution exposure. So that's the visualization of it. And then on the right, we did some analytics. Again, just kind of looking at what's this actually mean. So if you see in this table on the chart on the right is, if you live in LA County, your absenteeism rate's at whatever 13.9 at this level. Once you enter into this area, your absenteeism rate jumps by almost 30–40% to 17.1. And then once you live in that area and you're exposed to one zone, asthma danger zone, your absenteeism rate jumps another, almost 20%. So what we're doing right here is just a simple exercise of getting community data, measuring the impact, and doing the analytics behind it. Keeping it focused, making it simple. What is very clear, what we hope to convey is that once you go into this area and you're exposed to these asthma danger zones, the schools are going to almost have close to an 80% increase in school absenteeism. The more exposures you get, the more absenteeism the school's going to face. So then the next question is, what do you do with that? Well, our goal is making this, again, the data actionable and empowering. So hopefully what we can do with this, and this is a process we're still going through the mechanisms to develop this, is getting that data to then design data-driven interventions. We're recognizing where the schools are, the communities are suffering the most, using school absenteeism or proxy data to then design data-driven interventions. So for example, the policies could be the schools on the red dots, as you can see on the left. The government and the public health agencies, we should be focusing on providing air filters to those schools, and particularly the ones with the highest absenteeism rates. Second is crack down on truck idling, which is a major source of pollution. Our data shows that truck idling is directly related to the highest rates of asthma. So government agencies need to start cracking down on that. And then third, again, this is from the community. We don't take policy positions. We're not advocates per se. Our goal is to work with advocates to design the data, provide the data, empirical data analytics for the advocacy. But for this organization, they're very focused on, they want to see electric trucks. Because they believe if you put electric trucks, then we can cut the pollution from trucks, and then asthma rates will go down, and school absenteeism will go down as well. And then through this process, we not just advocating, but the advocate specific target policy actions. There are already regulatory frameworks that hopefully our advocates can use our data to specifically implement their demands. In this particular region, there's a Clean Port Action Plan, which is from the ports. And then the area has from the Regional Air Quality Management District to figure out, they have some measures demanded by the community to implement. So hopefully this map and our efforts is empowering the communities to change and influence and use data-driven interventions to really improve health in the community. So with that in mind, I want to open this the conversation to questions and Q&A, and love to hear people's feedback. Okay. Well, happy to answer any questions. If not, no worries. It's Saturday and there's a lot of great other sessions. So.
Thank you so much, Ray. We do, I think, maybe have some questions. Just a reminder that participants don't have access to audio, so it'll be through the Q&A in Nova, which Eric will help you moderate.
Oh, also before we begin, we do need some help with some data analytics, developing our interface of our map and website. So if any of our participants have friends are very interested in being involved in our project or volunteering with us or helping out, please feel free to contact me.
Hello, Ray. Can you hear me?
Yes.
Okay, great. We do have one question by Saroshi. She says, they say, such a fascinating application. I'd be interested in learning how this application may be transferable to other contexts, such as polluted cities and or developing economy.
Yeah, I mean, I think there's a couple ways that hopefully this could be useful is the process and the actual content. I think for us is this has been to get to where we are, it's been a lot of learning, a lot of feedback is again, each community has different unique issues and unique problems, but it's the one to identify what's the priority of the community and then building the tools with that. So one is not looking for it, a lot of when we talk about technology, it's always solution looking for a problem, but we really need to start drilling down on the problem and then finding the solution. So understanding the problem is really, really important, I think, for that. I think what specific things is, and we can offline, if you had specific questions, how to design a tool, happy, but again, going back to principle, keep it simple, making sure everything we do, the data is understandable. Like for us, asthma rates, hospitalization rates, and school absenteeism. That's something people understand very quickly. So I think we as a kind of a rule is if we have to explain something more than like 2 sentences, then we're not doing a good job. So again, finding what the indicators are, if we're going to measure the impact of pollution on health and such, finding what are the indicators are that people get right away. I think as important, because we are a data-driven entity, a focused entity, that everything we do has to be referenced with ideally with public source and open information that there's data behind it. So getting the community information, let's say like the pollution hotspots, how do we quantify that? We can't just quantify and say that's bad. If we know if the community says it's bad, then what we do is we go through the process of looking through, okay, where are ways we can measure that bad? And what we found is if you saw from this slide, it is bad by what we identified. So making sure you have really good data meaning that's understandable and available, that can somehow quantify the impacts. And a lot of times when you lack data, you also have to think about looking at proxy data, data that's that can be related, that can be kind of like, again, understandable, but also available, but also people can get to use or measure our impact. So I hope that kind of answers your question.
Great. Thank you so much for that, Ray. Anybody else have questions? Also, I just want to direct you guys to the chat, just in case. I did post the SmartAirLA website, Ray's email, a contact information link for SmartAirLA as well, and how you can follow them on Twitter.
Oops, sorry. Okay. Well, feel free if you guys have any questions, or if you actually we're looking for help. So please feel free to contact me. And if you guys have feedback, let us know what your thoughts are, how we can improve this map. It's again, it's a learning process. We don't pretend to know the answers, and we are humbled that every time we do something. I think when we develop actionable data, is really making sure that we listen and understanding that when we put the data out there, it's not like it takes time, it takes education not just from the community but also for us. We have to be educated, we have to learn what we're doing, why it's not working, and what we can get better. And the best key, if I can advise folks, is to always be listening. It's not easy, it's not an easy process. I mean, it's easier for us to just sit back and we can do these analytics behind our desk and then just put it out. But that's, at the end of the day, you know, as we talked about, data is only good if it's being used, and also if it's being used to make change. So yeah, that's kind of our takeaway. And if you guys have other lessons learned and experiences, we'd love to hear from you as well. So thank you.
Thank you, Ray, for your presentation. Really appreciate it. And I appreciate all the attendees for their questions and interaction during this session. Please contact the speaker if you have any further questions regarding this topic. You can also see some of the links that Eric posted on the community chat. Please provide your comment and feedback to us or the organizers on the community board, or start a discussion there to connect with others in the DataCon LA 2020 community, where this is obviously a work in progress with these digital conferences. So any sort of feedback will help. Thank you all again. Have a wonderful day. And thank you for being a part of this year's DataCon LA. This session has ended. Thank you very much.